How tramadol, touted as safer opioid, became a third-world peril. KAPURTHALA, India, AP, reports rolled in with escalating urgency, pills seized by the truckload, pills swallowed by schoolchildren, pills in the pockets of dead terrorists. These pills, the world has been told, are safer than the OxyContins, the Vicodins, the fentanyls that have wreaked so much devastation. But now they are the root of what the United Nations named the other opioid crisis, an epidemic featured in fewer headlines than the American one, as it rages through the planet's most vulnerable countries. Mass abuse of the opioid tramadol spans continents, from India to Africa to the Middle East, creating international havoc some experts blame on a loophole in narcotics regulation and a miscalculation of the drug's danger. The man-made opioid was touted as a way to relieve pain with little risk of abuse. Unlike other opioids, tramadol flowed freely around the world, unburdened by international controls that track most dangerous drugs. But abuse is now so rampant that some countries are asking international authorities to intervene. This story was produced with support from the Pulitzer Center on Crisis Reporting. Grunenthal, the German company that originally made the drug, is campaigning for the status quo, arguing that it's largely illicit counterfeit pills causing problems. International regulations make narcotics difficult to get in countries with disorganized health systems, the company says, and adding tramadol to the list would deprive suffering patients access to any opioid at all. This is a huge public health dilemma, said Dr. Gilles Forte, the secretary of the World Health Organization's committee that recommends how drugs should be regulated. Tramadol is available in war zones and impoverished nations because it is unregulated. But it is widely abused for the same exact reason. It's a really very complicated balance to strike. Tramadol has not been as deadly as other opioids, and the crisis isn't killing with the ferocity of America's struggle with the drugs. Still, individual governments from the US to Egypt to Ukraine have realized the drug's dangers are greater than was believed and have worked to rein in the tramadol trade. The North Indian state of Punjab, the center of India's opioid epidemic, was the latest to crack down. The pills were everywhere, as legitimate medications sold in pharmacies, but also illicit counterfeits hawked by street vendors. This year, authorities seized hundreds of thousands of tablets, banned most pharmacy sales and shut down pill factories, pushing the price from 35 cents for a 10-pack to $14. The government opened a network of treatment centers, fearing those who had become opioid addicted would resort to heroin out of desperation. Hordes of people rushed in, seeking help in managing excruciating withdrawal. For more on this story, visit the news article link.